Hi, I'm Dr. Prathik R, consultant urologist. Today I'll be talking on a common topic called benign enlargement of the prostate. Benign enlargement of the prostate is a common condition which happens in 50% of the population who are above the years of 50. What are the common symptoms a patient who has benign enlargement of prostate includes? Increased frequency, nocturia, urgency, poor flow of urine, hesitancy, urinary incontinence, recurrent UTI, and blood in urine. When a patient comes with these symptoms, we need to evaluate the patient by getting a few investigations like urine routine analysis to know if there is any infection, serum creatinine to know if there is any damage to the kidneys because of the enlarged prostate. We need to get a uroflowmetry which assesses the flow, how a person is passing urine, ultrasound KUB which tells us the size of the prostate and there is any enlargement of the kidneys due to the prostate and whether the patient is keeping some amount of urine in his bladder, and a serum PSA or a prostate specific antigen which tells if there is any evidence of malignancy secondary to the enlarged prostate. What are the treatment options when a patient comes with benign enlarged prostate? Includes watchful waiting, which includes reassurance to the patient with education and conservative treatment with dietary changes and lifestyle changes for people who are having mild symptoms or moderate to severe symptoms which are not bothering his normal day-to-day activities. Other treatment option includes medical management, which includes treatment with alpha blockers. The most commonly used include tamsulosin or a sildenafil, or combination therapy with an alpha blocker and a 5-alpha reductase inhibitors which are given for people who have a size in the prostate more than 40 grams, or a combination therapy with an alpha blocker with an anticholinergic which is commonly used for patients who are having storage symptoms predominantly like increased frequency, nocturia, and urgency. The surgical treatment option includes a transurethral incision of the prostate where we put an incision at 5 and 7 o'clock, which is done for individuals who are of younger population and who are having a very small size of prostate of less than 30 grams. A TURP or a transurethral resection of the prostate, which is most commonly done with a monopolar or a bipolar cautery machine for size of the prostate which is 30 to 80 grams, where we are going to resect the prostate using a resectoscope. The most common or the most advanced technique includes the holmium laser enucleation of the prostate, where we use the laser to enucleate the prostate, which is commonly done for people who are having more than 80 grams of prostate or with individuals who are on anticoagulants or on antiplatelet medications because of previous cardiac events or other stroke, which reduces the bleeding risk because of the usage of the laser.